Go.
Hello, I'm Dr. Allison Divers of the Art and Science of Dermatology, and I want to take a couple minutes to talk to you about a passion of mine, sunscreen. The best sunscreen is the one that we wear, right? The one that we get from the bottle onto our skin in appropriate amounts. In order to be good, everyday, habitual sunscreen users, we've got to not mind putting it on our skin, and more ideally, we've got to like putting it on our skin. It's got to feel good instead of greasy and goopy, which is, of course, the #1 complaint for not using sunscreen. What feels good on my skin is not what necessarily is going to feel good on your skin. So there can be some effort involved for each of us in identifying for ourselves that sunscreen which we actually like putting on and therefore that we'll use every day. A little bit about sunscreen labels. The FDA suggests that you use a sunscreen labeled SPF 15 or higher. We as dermatologists and members of the American Academy of Dermatology recommend an SPF 30 or higher. The label needs to say broad spectrum, and though according to the criteria of the most recent FDA sunscreen guidelines, it should be water resistant. However, for everyday use where you're not going to be in and out of water or involved in activities where you're going to be sweating, that's not so important. What is important, and I see rarely addressed in articles and sunscreen talks, is a statement on the sunscreen label, usually the back, sometimes on a box that may have been discarded, a statement that says that this sunscreen, not just sunscreens in general, but this product has been proven to decrease the risk of skin cancer. If it only says that it's been proven to decrease the risk of sunburn, it's not good enough. There's no perfect sunscreen, and therefore we should not be solely depending on sunscreen alone for our best sun protection. We need to consider our sunscreen as one component of a more comprehensive sun-smart lifestyle. We should be limiting sun exposure even with our sunscreen on, especially between the hours of 10 a.m. and 4 p.m. We should be seeking shade. We should wear protective clothing, broad-brimmed hats, and good sunglasses. If you can incorporate these sun-smart behaviors in addition to your sunscreen, you will over the years greatly decrease your cumulative sun exposure, therefore your cumulative sun damage, and therefore decrease your risk of skin cancer, most importantly, but also you're going to increase your best chances for your skin to age beautifully. Photoprotection, protecting your skin from sun, is the #1 anti-aging strategy for your skin. So thanks for your time. I hope that this has been helpful and you've learned something. For those of you who knew it already, kudos to you. So have a great day. Go forth and be sun safe.